Thyroid recovery, going from fatigue to fantastic naturally. According to the Association of Clinical Endocrinologists, some 36 million Americans suffer from thyroid dysfunction, half of which go undiagnosed. Many of these cases is due to an autoimmune disorder called Hashimoto's. But all too frequently, the question of why the thyroid gland quit working never comes up. Thyroid replacement hormones oftentimes are our first line of defense, but taking this approach is like turning a blind eye to what caused the thyroid to become depressed in the first place. It's far wiser to ask what the faulting thyroid says about the entire body and proceed from there. In this video, we will look at what caused the thyroid to slow down in the first place. When I started addressing underlying causes of low thyroid, my patients began to enjoy not only symptoms of relief, but also true health. No matter what thyroid symptoms that you are struggling with, know one thing for sure: thyroid recovery is possible. Hello and welcome. I am Dr. Siegel, and I would like to thank you for taking your time to review this information about how we are able to help hundreds of people struggling with thyroid issues just like you. I began practice in 1983. I am a doctor of chiropractic. I am a certified clinical nutritionist, and I hold a board specialty or diplomate in the American Clinical Board of Nutrition. I'm the medical director of BioHealth Wellness Center in Westerville, Ohio, and I've spent hundreds and hundreds of hours in postgraduate education in areas such as functional endocrinology, neurology, nutritional biochemistry, toxicology, homeopathy, and much more. And I hold license in good standing in both Ohio and Florida. Health is a precious gift that is taken all too often for granted. And for anyone facing any number of health issues, it soon becomes evident how these challenges can rob you of quality, quantity, and the overall enjoyment of life. And individuals, maybe like yourself, with thyroid conditions are certainly no exception to this struggle. There are literally millions of people suffering from a thyroid illness, but have yet to find effective non-drug options for improving their health. So I ask you, if you will, ponder the following questions. Are you unhappy where your health or lack of health currently is? Do you find that enjoyment of life has been or is being impacted? Do you take thyroid hormones, yet you still are suffering from various symptoms? Would you like to feel better than what you currently do, but maybe you've been told that there's nothing else that can be done? Have you ever felt that maybe something has been missed in the treatment or management of your thyroid or overall health picture? Are you sick and tired of being sick and tired? Do you still have any of the following low thyroid symptoms, yet your lab tests are said to be normal? Perhaps depression, maybe anxiety, lack of focus, brain fog, weight gain, constipation. Maybe you've been feeling like you've been hanging on by a thread, that you're at the end of your rope and maybe ready to snap. Headaches perhaps, especially headaches in the morning. Lowered energy and stamina. Various gut issues like bloating and excess gas. Maybe your hair's been falling out. or at least thinning or becoming brittle. Disrupted sleep, insomnia, maybe trouble getting to sleep and or staying asleep. Dry skin at any time, not even the winter months even. Muscle cramps even while resting. Or any number of other symptoms such as loss of the outside portion of the eyebrows. Edema, especially in the face, what's referred to as myxedema. Maybe poor circulation, the hands and the feet. Maybe you catch viral bacterial issues easily. Maybe wounds heal slowly. Understand, no matter what symptoms or group of symptoms you may have and for how long, you certainly are not alone. As I said before, over 36 million Americans suffer from some sort of thyroid illness, and up to 50 to 60% aren't even aware that they have one. For many people, in their long search for answers on what to do to get well, the continued suffering eventually leads to diminished hope. And that's why I do what I do. My motivation and number one goal is helping to transform your health for the better, so that you can experience greater enjoyment out of life, reduce suffering, and improve productivity. Do so that maybe it's time to explore other avenues that could lead you to the relief that you've been seeking. The thyroid is a butterfly-shaped gland that's located in the neck, just below the Adam's apple. This is an overview graph of the many different parts involved in thyroid production and utilization. We start with the brain, the hypothalamus pituitary, kind of where the thermostat is, producing hormones to influence the thyroid, or the furnace. That then produces the T4 and T3 hormones, or the heat. Then the T4, which is inactive, has to be converted over to T3, the active part of the thyroid hormone. That then is transported by the taxicabs, or the TBG, into the receptor sites or parking spots of the cells. This enables the cells to take the thyroid hormone into the cells and thus use it for the various tissues and cells of the body. Basically, the thyroid runs our metabolism. It's the gas pedal of the body. An important fact is that every cell of your body has thyroid receptor sites, or these parking spots. Therefore, thyroid hormones impact all major systems of the body. As a result, it's a must that when viewing or interpreting or looking or examining anything dealing with the thyroid, you must have a whole body view. As I said before, many issues can come into play to affect the body and thus the thyroid. 90% of the time is due to an autoimmune response. Blood sugar, toxicity, excess inflammation, infections, nutrient deficiencies, and much more affect the body and therefore can affect the thyroid. There are two basic types of thyroid issues, hypo and hyper, too little, too much, and each has their own set of symptoms. But overall, autoimmune, where your body's own immune system attacks the thyroid, is responsible for 90% of thyroid dysfunction. Some interesting facts about the thyroid. For example, low thyroid increases your risk of memory loss. It increases your risk of heart attack. It increases your risk of diabetes, as well as increased blood pressure. In addition, it can weaken your immune system, none of which is a favorable condition. As we age, thyroid disease becomes more common. Typically, women are more prone to thyroid issues versus men, up to 4 to 7 times more common in women. Some studies show that up to 50% of depression is caused by an undiagnosed thyroid condition. And basically, any thyroid disorder is a chronic illness. It means that your body has been sick for years, and now you have just recently had a label. In pregnant women, low thyroid can run the risk of causing mental retardation in babies. It can also cause premature delivery as well as miscarriages. In states of low thyroid or hypothyroidism, hydrochloric acid production in the stomach is reduced, and this can result in malabsorption of nutrients, undigested proteins, and various digestive complaints. According to a study called the Rotterdam study, older women with subclinical hypothyroidism were almost twice as likely as women without this condition to have blockages in the aorta. They were also twice as likely to have had heart attacks. According to the Journal of Metabolic and Endocrine Disorders, 90% of hypothyroid or low thyroid is caused by Hashimoto's, and medical doctors have no idea how to address an autoimmune thyroid. There are 6 major thyroid patterns: primary hypothyroidism, hypothyroidism secondary to pituitary hypofunction, what's called thyroid underconversion, thyroid overconversion, elevation of TBG, and thyroid resistance. And again, keep in mind that Hashimoto's or autoimmune disease is the #1 cause of low thyroid. Again, keep in mind this overall diagram of what's involved with thyroid function and operation as we get into the individual thyroid types. Basically, there's 5 to 6 levels of your thyroid hormone pathway. We can have something involving the thyroid gland itself, maybe your liver and intestinal tract, something going on in your bloodstream, at the cell receptors or the parking spots that accept the thyroid hormone, or maybe inside the cell itself. This is more of a visual representation of where these highlighted areas that you see on this graph come into play where something may go wrong, whether it's in the thyroid itself, maybe over where T4 is being converted to T3, like in the liver or the gut, maybe a problem with the transport or the receptor sites, or once the hormones are inside the cell. Each of these spots have their own unique set of circumstances that could cause or create a low thyroid condition. When you have something going on in the thyroid itself, there are many reasons for this. Listed here are just a few samples of why, such as gut issue, a blood sugar imbalance, possibly an infection, maybe elevated cortisol, a stress response, and some form of inflammation. The second reason is hypothyroidism due to a pituitary low function or hypofunction. Usually on blood work you may see a TSH below 1.8. And here the pituitary is just fatigued and TSH production is just low. Again, inflammation, infection, chronic stress, lowered neurotransmitter levels, autoimmune disorder, all this could be a reason why the pituitary is functioning less than optimal, thus causing less than optimal function in the thyroid. Third reason is what's called conversion or underconversion issues, where the T4 is being converted to T3. Here, whatever the interference is, it creates less T3 and usually often too much usable or unusable reverse T3. So looking at your reverse T3 number on your blood work is very important. Again, excess cortisol or stress, chronic inflammation, chronic infection, low iron can be a reason. Imbalance or what's called gut or GI dysbiosis, decreased progesterone, decrease cofactors like iodine or tyrosine, zinc, and selenium. Even low-calorie diets, especially for a prolonged period of time, can cause some problems with the conversion of T4 to T3. Here's where we have more taxicabs, the elevated TBG, than what the body needs. And in this situation, oftentimes it ends up giving us too little free T. An elevation of estrogen, either through hormone prescriptions or contraceptives, are many times the big reason why we have elevated TBG, thus resulting in symptoms of low thyroid. The next one is if we have problems with the cell receptors, where the T3 is having trouble locking onto the receptors so it can be utilized. Basically, the receptor sites have become less active and slowed down eventually the production of thyroid hormone. Excess inflammation, cortisol, stress response, elevated homocysteine, or low vitamin A. This is oftentimes some of the reasons. Then we have something called thyroid resistance, where, again, T3 may be having some trouble getting into the cells via the receptor sites, but also trouble being utilized properly once inside. In this situation, oftentimes the labs are normal, but the patient is still experiencing low thyroid symptoms. Again, we mentioned before, homocysteine elevation, low vitamin A, excess inflammation, excess cortisol. You see some of these patterns repeating themselves and how they can affect various aspects or stepping stones throughout the thyroid production and utilization pathways. But again, over 90% of all thyroid issues are autoimmune related. Instead of them being really a thyroid problem, they're more of an immune problem causing thyroid symptoms. And this is what's called Hashimoto's. Common reasons, again, that we've already mentioned: stress, elevated cortisol, inflammation, toxicity, infections, deficiencies and excesses of hormones or nutrients. So when you're looking at thyroid issues, again, you have to look at multiple factors, and you have to look at the whole body. Oftentimes, I get the question, why would your immune system do this? Why would it start attacking your body tissues, such as your thyroid? Well, there's two main reasons. What's called dysregulation. It's where your immune system is imbalanced due to, again, chronic stress response, hormone imbalances, blood sugar imbalances are some examples, or it may be due to what's called an active antigen. It's where your immune system has become imbalanced due to chronic infection, bacterial, viral, parasitic, a food sensitivity like gluten, environmental toxins like heavy metals and pesticides, and undigested food particles resulting from a condition known as leaky gut. So let's discuss the three most common mistakes that traditional medicine makes with thyroid issues. One is the view or the mindset. Two is testing. And three is treatment. So I want to talk a little bit more about each of those in greater detail. Mistake number one is the traditional view or mindset. Basically, it's one of isolation. It's looking at one single area or one single part, in this case, just the thyroid. It's not taking a whole body view. It looks at just numbers and not the whole person. It's more oriented towards symptoms, not underlying causes. There's limited tools that are used therefore, just prescriptions and surgery, and that's pretty much it. And as far as any influencing factor or trigger, it doesn't matter to them. So what's the fix for mistake number one? Well, my fix is you have to take a whole body view without exception. Remember, the thyroid hormone affects cells of all organs and tissues of the body. Therefore, you have to look at the whole body. And you have to look at the person, not just looking at that individual as a set of numbers. You have to explore all and any underlying causations, not just what the symptoms are. And any and all triggers often matter. Any influencing factor that could influence the body as a whole or in part has to be taken under consideration. This graph gives us a good idea of how your lab test can be normal, but a person can still feel sick. Functional ranges are healthy ranges, reference ranges are sick ranges, and much wider. So when we look at a lab test, it comes in the form of the reference range. Well, what we want to do is put it into a functional or healthy range, which gives us a better idea of risk assessment for disease before it develops. And over the past 50 years, ranges have broadened quite a bit as the health of the population has declined. So you basically have to be much sicker before you're told that you're sick. Some examples. Let's say we look at your blood glucose, blood sugar, and then the reading is 73. In the reference range, the range acceptable is 65 to 110. So 73 is inside that range, therefore it's going to be considered normal. In a healthy functional range, the range is tighter, 85 to 100. 73, therefore, would be hypoglycemia or low blood sugar. TSH, say your reading was 4.2. Reference range may give you a range of 0.3 to 5.5, so 4.2 is considered normal. But a healthy range is more 1.8 to 3, so your 4.2 reading would be hypothyroid, and so forth and so on. Dr. Tatis Karazian, who wrote the book, Why Am I Still Having Thyroid Symptoms Yet My Labs Are Normal?, said that the grossest mismanagement of hypothyroidism begins and ends with the blood test. This is so true. The fix for mistake number 2 is you have to use expanded testing, more whole body testing like chem panels and inflammatory markers, and you have to do more extensive thyroid testing, TSH, total T3 and T4, free T3 and T4, testing the thyroid antibodies, and maybe other hormones like the adrenals or male and female glands as well. You'll have to also take your test results and put them into a functional range that gives you more of a reflection of how your numbers compare to healthy population rather than the reference range or a sick population. And mistake number 3, treatment. Again, traditional approach, it's more isolation, looking at one single area or organ. It's looking at the numbers, not the person. It's chasing symptoms with drugs. And again, the limited tools, the drugs and surgery only, and the triggers, influencing factors, they don't even matter. The fix for mistake number 3 is you must absolutely have a whole body approach. And that is what we do. You have to focus on the person, all aspects of the person, not just looking at the person as a set of numbers. You have to take your focus and direct it on the underlying causes while still trying to help the symptoms. And you have to use expanded tools like diet, lifestyle, supplementation, and other therapies like PEMF. Also important is you have to know that the triggers matter. So when we're looking at a case, the triggers do matter. All these influencing factors come into play. And overall, think that, is this an autoimmune case? Which, by the way, 90% of thyroid issues are. So what makes our approach different regarding our thyroid recovery program? Our success is based upon a couple main things. Number 1, we take a whole body functional medicine approach, and we use comprehensive testing and treatment approaches to uncover each person's unique underlying causative factors to their health challenges. The difference basically between functional medicine and conventional medicine is more geared towards symptom relief and using drugs and surgery after disease manifests itself, whereas functional medicine is geared more toward wellness and prevention with more natural nutritional supports and before disease manifests itself. Overall, our approach is not a one-size-fits-all, as is common in traditional medicine. My functional medicine approach is going to look at underlying causation, the whole person, not just a set of symptoms, or looking at a person as a set of numbers or a single organ. We're going to take a very detailed history, and triggers matter. We're going to do comprehensive lab testing and looking at the functional ranges, not just the reference ranges. We're going to examine all the possible autoimmune connections. We're going to use what's called targeted functional toxicology. We'll explain that in a second. We're going to use targeted nutritional and homeopathic support. We're going to use things like pulsed electromagnetic field therapy, laser, and red light therapies. This represents a brief overview of our thyroid program. A person comes into the office with various symptoms like fatigue and weight gain and anxiety. We have to look at the possible influencing factors such as elevated cortisol, inflammation, toxicity. And then we're going to have a pushback. What do we do from a testing and treatment perspective? And then what do we do from looking at the requirements for success, as I call it? Complexity of the case. What's the person's motivation? Why are they doing what they're doing? Are they ready to move forward? And are they ready to invest in terms of time, money, and effort? First off, it's important to understand the nature of the influences or triggers. As mentioned prior, inflammation, toxicity, liver, gut issues, blood sugar, infections, excess and deficiency of hormones, poor diet, illnesses, and so forth. These all need to be considered as possible influences. Requirements for success, as I said, complexity, motivation, readiness, and investment. Let's look at each one. Complexity basically is how complex is one's thyroid or overall health picture. Because there's various degrees of testing and treatment that may be needed. The greater the complexity, the more time and effort will be needed. And if any permanent damage has been sustained, then the extent of that damage will often dictate the degree of recovery. The next aspect is motivation. What is your personal why? Why are you doing this? And is it big enough to motivate you into action? Or is it because you're just overall experiencing a degree of frustration? Or is the quality and enjoyment of life being reduced? Are you still not feeling well despite lots of effort and time and money spent? But what is your why? The next aspect is readiness. How ready are you to move forward? One may be motivated to improve their health, but maybe they find themselves lacking a total willingness, or the fact that they're just not ready to move forward and take action. But until you actually take action, nothing else is going to matter. And the last aspect for requirements for success is investment. As with most things in life, time, effort, and money are needed to bring it all together with the motivation, with the readiness, and thus with action. The pushback part is the list of tests and treatments and resources that are needed to combat the list of symptoms and the influencing factors that's going on. Functional toxicology, this is something that no one else does in the entire state, and very few do it in the country. This is something that I do specialize in, and it brings great success to the table when we're dealing with thyroid and other conditions. We may need to use targeted and customized nutritional support, supplementation, dietary, lifestyle changes, and so forth. We use what's called PEMF, or pulsed electromagnetic frequency treatment. We also use laser therapy and red light therapy that also has a list of benefits to it. We all live in a toxic soup in this world. Every single person. We get exposed to viruses and bacteria and parasites, chemicals, pesticides, heavy metals, electromagnetic frequencies. And we will be continually exposed to this toxic soup. So it's imperative that every effort is made to reduce this toxic buildup. And that brings me to what's called functional toxicology. It's a process in which I use more of a reflex system to diagnose and find the proper therapies at eradicating from the body the toxic substances and biological agents that are seen oftentimes as the primary source of chronic illness. PEMF, or pulse electromagnetic field therapy, is a therapy in which the cells acting like batteries are recharged, or where we raise up the voltage. Every cell in the body is essentially a battery that carries electrical charge, and that is what allows it to function properly. As with any battery, if the charge is low, function is low, and performance is inherently disrupted. With low cellular voltage, pain signals are turned on and function goes down. With PEMF therapy, it helps to recharge the cells or raise up the voltage, and this helps in stimulating the natural healing process, reducing, eliminating pain, and improving function. This is a look at what our PEMF unit looks like. You can see the chair and stool, so a person can receive the therapy sitting up in a comfortable position, or they could lay down in a comfortable position flat on their back with various applicants or applications to various areas of their body, like the thyroid. The other tool that we use, obviously, as mentioned, is targeted customized nutritional supplementation and dietary guidance. Low-level laser, also known as cold laser, has a very specific function as well. It will stimulate the circulation and lymphatic drainage, and it also aids in the healing and repair process of any organ or cells. It also helps to stimulate the production of ATP, or energy, inside the cell, which is the way the body operates. It needs an energy source, and ATP is our main energy source to fuel the operations of the body. So keep in mind, no matter if your interest is spending more time with your family, having more recreation time, working on hobbies, enjoying your retirement, life is short and time is ticking. So action is the only thing that's going to get you from point A to B. So I ask you to ask yourself, are you a fence sitter or are you a health-seeking warrior? If you're a fence sitter, then you're okay with the status quo. You're not going to do anything that you haven't done already. Or are you a health-seeking warrior and you're ready to take effective action towards getting better? So remember, it's your choice. When it comes to impacting your health, you have three basic choices. You can do nothing, same, or something different. If you do nothing, you're basically non-responsive and you're just ignoring the situation. You can choose to do the same thing that you've been doing and getting the same outcomes, or you can do something different in order to improve your health. If you're someone who's still struggling with health issues, whether it be thyroid or otherwise, I would strongly encourage you to explore doing something different. So what's the next step? Well, if you're one whose quality of life is being impacted by a possible thyroid issue or some other unresolved health issue, if you're one that is seriously ready to get some real answers and help, and if you are finally ready to take action and stop suffering, then take action by calling 614-423-7753 to schedule a no-charge, no obligation, no pressure consultation. So one thing to understand is that there is light at the end of the tunnel, and hope is just a call away. This quote is from someone who knew all too well about suffering and sacrifice. It's Helen Keller. And she said, although the world is full of suffering, it is full also of the overcoming of it. What a beautiful statement about hope. Thank you for taking your time and effort to sit down and watch this video. I hope that the information was informative as well as useful. Know that we are here to help answer and assist in any way that we can. And at BioHealth Wellness Center, we look at us as where wellness begins. And maybe that is where wellness will begin for you. So give us a call at 614-423-7753. You can email us at staff@biohealthohio.com and visit our website at www.biohealthohio.com. And don't forget to follow us on Facebook, Twitter, and Instagram. Thank you. Have a beautiful day and be healthy.